To Go segment is sponsored by Corewell Health.
Injuries are never convenient, nor do they tend to occur at ideal times. Your child twists a knee during a soccer game after school, or you injure your shoulder late on a Saturday morning. Well, the good news is West Michigan has orthopedic specialists available to help outside the traditional doctor's office hours. Here to talk about Spectrum Health Orthopedic Urgent Care is Dr. Jim LeBolt. He is an orthopedic specialist with Spectrum Health, soon to be Corewell Health. And welcome to you, Dr. LeBolt.
Hey, thank you. Thanks for having me.
I'm glad to. Tell me about the after-hour services that are offered at Spectrum Health, Corewell Health.
Yeah, so at Spectrum Corewell now, we have an orthopedic access clinic. It's a walk-in clinic. It's open from 8 a.m. to 8 p.m. Monday through Friday. And we're also open from 9 a.m. to 3 p.m. on Saturdays. And it gives patients with orthopedic issues, and these are issues that can be any body part or extremity outside of back pain or neck pain, an opportunity to come in and see an orthopedic specialist without an appointment, without a referral from their primary care source, or without a referral from an emergency department or a standalone urgent care.
So who's working there and how does it work exactly?
Yeah, so we have orthopedic specialists that staff that location. So these are folks that have experience in multiple areas of hand, foot, and ankle, knee, hip issues, shoulder issues. We also have non-operative physicians that staff that. Some of those folks also work in the emergency department, but they spend time with us working in our orthopedic clinic, and they're able to diagnose, provide treatment, whether it's a fracture, whether it's ordering x-rays, whether it's providing casts, splints, braces, or crutches. We're able to provide those in that clinic locations.
What kind of patients do you see? Is it adults and children?
Yes, so we see all age ranges at the location. So this time of year, pretty typical would be someone my age, maybe mid-40s, that is working in the yard, is overdone a little bit, starts having shoulder pain. Tried to ice it. I've tried to take some anti-inflammatories at home. It's not getting better, and I want to get it checked out. And without going through the rigmarole of calling different providers or maybe calling my primary care specialist, who's very busy, I'm able to see an orthopedic specialist the same day by walking in.
How do I know that I have the sort of injury that would allow me to go to your place?
Yeah, so the biggest thing is something that doesn't occur, that doesn't improve. So you've tried ice, you've tried resting it, you've tried taking some anti-inflammatories or some Tylenol over the counter. It seems to be persistent. And it's not, if it just happened, it might be worth your time to try to calm it down, try to ice it, work through some motion exercise. But if it stays around for a couple of days, it may be worth seeing someone to make sure we're not missing a bigger type of injury.
Why is this a better option than an urgent care? Because I think a lot of us are trained to go to the urgent care, instead of the ER.
Yes, I know a lot of my neighbors, same thing. Why don't I just go to the med center for this? And the difference in the med center, very busy with sick patients. The emergency department, very busy with sick patients. But this offers a lower cost option for patients in most cases. So they're not paying that emergency department copay, or they're not paying a standard urgent care copay. They're coming in to see an orthopedic specialist that same day. So a lot of times when you go to these locations, they're sending you to other sites. So they're saying, yes, hey, it's okay, nothing's broken. You can live with this for right now. We're going to refer you on to an orthopedic specialist. You then require a second visit. With this, it's a one-stop shop. You may require some follow-up care, but you're seeing that orthopedic specialist at that initial visit.
I know there are a couple other tidbits that you want to let folks know about, including information about a fracture clinic.
Yeah, so our orthopedic trauma specialists run a fracture clinic daily as well. This is Monday through Friday. So you can also call, and we'll be able to provide that information to our patients. And these are fellowship-trained orthopedic surgeons who specialize in fracture care. We see fracture care at our Ortho Urgent Care clinic, but these folks also run a clinic that complements that. And you're actually seeing a surgeon or their designated orthopedic specialist that day for those walk-in appointments as well.
All right, very good. Well, the Spectrum Health Orthopedic Urgent Care is at 4100 Lake Drive Southeast in Grand Rapids. Again, it's open weekdays 8 to 8, Saturdays 9 to 3. You can reserve a spot in line by calling the phone number on your screen. It is 616-627-7000. And for more information, visit spectrumhealth.org. Dr. LeBolt, thank you.
Thank you so much for having me.